facilitate the view a little bit easier. So my name is Tracie Bills. I'm the Executive Director of the California Resource Recovery Association. We are very excited to have such an incredible turnout of 175 people on this webinar. Definitely the new norm of working from home. So I'm sure there'll be a lot of discussion on how to multitask with parents who are homeschooling and trying to get their jobs done. First off, just a little bit of housekeeping. As I mentioned, make sure you mute yourself. That's really important. We want to have an interactive conversation, but we also, while people are talking, we want to make sure that you're muted. Thank you to all those who submitted questions yesterday. I will be highlighting them throughout the webinar, so appreciate the heads up so we can try to answer those or at least have the part of the conversation. We will be videotaping this webinar, so if you want to refer back to the conversation or whatnot, we will have that online. And then additionally, we will also be copying down all of the questions so that we can make sure for the CRRA program at the conference, as well as we move forward with the conversations over the next couple of weeks, that we can keep track of all of that and make sure that we're helping one another. If you, I already mentioned, if you go to the top of the screen, you can see the different cameras. So that is actually helpful, view active cameras. And then lastly, SWANA is offering 1 CEU credit if you would like that. Make sure that you send Despina or CRRA an email and we can provide it for you. We have to keep track and let SWANA know who's actually in attendance. But if you want that credit, let us know. So with that, I wanted to go ahead and show a few resources. Despina, can you show the our website? So CRRA has a COVID-19 web page, and it has a bunch of different resources. And I will tell you, it's not everything because there's a lot of stuff out there, but it's a lot of the different highlights. We've got some stuff for small businesses in California. The National Waste and Recycling Association has been doing a lot of advocacy at the national level. And if you scroll down a little bit more, the Resource Recovery Association of California, they're previously the California Refuse and Recycling Council. They are the primary association for collection companies. They have a lot of really great resources navigating the collection side of things, so take a look there. And then OSHA obviously is on there, and that's a big concern for all of us right now as well. And then lastly, the other resource is the forum, and at the very end of this webinar, we're going to go ahead and talk about how to sign up for the forum, and that's where we're going to interact on a daily basis, asking questions, sharing documents, and really facilitating more of this conversation online. So with that, I'm super excited to have Kara Morgan here with CalRecycle. She was going to take a few minutes to update everybody on what's going on at the Capitol. So Kara.
Thanks, Tracie. Thanks so much for having me say a few words on behalf of CalRecycle. First of all, before I start, I just want to express that I hope everyone on the call is well and safe, and I'm thinking about all of you. This truly is an unprecedented emergency that we're all going through together, both professionally and personally. And it's a dynamic situation for all of us. Many stakeholders have been sending CalRecycle questions on a number of topics, including defining essential services and compliance concerns and a myriad of other issues. Just to update you, CalRecycle's executive team has been logging all of these and categorizing all of these inquiries. The team is currently working on guidance, including creating a web page soon to share all of our responses with all of our stakeholders. We recognize the important concerns raised by jurisdictions and haulers about compliance with 939, 341, and 1826, and we will be addressing those concerns. You might remember in 2018, with the national sword crisis, CalRecycle provided reassurance to jurisdictions, and we shared the approach that CalRecycle would take and using our CWIMP enforcement policy. That same approach can be applied in this situation. Soon, CalRecycle will be sending a letter to jurisdictions on this. LEAs have also already been provided information about granting storage waivers, as was also done in 2018. Our CalRecycle executive team is also looking at the timelines for grant applications and comment periods for our regulations. For example, some of you may have seen that about 11:13 today, CalRecycle sent out an email extending the application period for the Community Composting for Green Spaces grant program. The new grant application deadline is now Thursday, April 30th, and the Q&A period was also extended. So I just want to say that we will get through this, and we are getting through this, and I'm really grateful to work with all of you and support you through this just almost surreal time that we're all going through. Back to you, Tracie.
Thanks, Kara. And just a note for attendees that there are a number of CalRecycle staff on the call, and they are here to basically listen to the conversation, understand concerns and needs. Therefore, they will not be answering any questions at the time, because the reality is this webinar is really geared for interaction amongst our attendees and our members to share ideas and concerns and best practices, if we have any so far. And while we have the three presenters initiate the conversation, we also really want feedback from everybody on the line. So with that, I'm going to go ahead and move on to introducing our three speakers. Our first presenter is Patrick Mathews, who is the General Manager and Chief Administrative Officer for Salinas Valley Solid Waste Authority. He has 38 years in the environmental management field, with the last 12 years as General Manager and Chief Administrative Officer for Salinas Valley Solid Waste Authority. His responsibilities include capital projects, infrastructure, development and permitting, resource recovery programs, new resource recovery technology research and development, environmental programs management and CEQA, grant management, public administration, and finance. Patrick has a BA in environmental studies and chemistry with training through UC Davis in integrated waste management and hazardous materials management, and a certified manager of landfills operation and compost programs through SWANA. Patrick is also the secretary of our SWANA Gold List chapter. Our second presenter is Ted Ward, Director of Del Norte Solid Waste Management Authority. Ted has promoted the creation of jobs from discards and environmental design, ending welfare for wasting, and zero waste for the last 2 years. After returning from Kenya, where he volunteered as a teacher for the Peace Corps, Ted was a recycling market development consultant in Arcata as he earned his master's degree and taught for 2 semesters in the Environmental Resources Engineering Department of Humboldt State University. In 2015, Ted became director of the Del Norte Solid Waste Management Authority, where he has worked since 1994. In addition to their recycling programs, Del Norte County now has product stewardship programs for mercury thermostats, all household batteries, paints and stains, carpet and carpet padding, mattresses, and box springs. Mr. Ward currently serves on the CRRA's Global Recycling Council and is on the board of the California Product Stewardship Council. And this is the best. He says that his life is garbage, but he's in recovery. And then our last presenter is Colleen Foster, who is an environmental officer for the city of Oceanside. She has 15 years of experience within the public and private sector and is highlighted by multiple achievements as it relates to zero waste, food recovery, stormwater, environmental compliance, climate action, program development, outreach, marketing, and legislative advocacy. Colleen's personal and professional endeavors feature her commitment for positive leadership and stakeholder engagement, and an intense dedication to actively promoting sustainability, civic duty, and conservation within a diverse array of communities. Colleen is actually the president of CRRA and a Southern California board member of the California Product Stewardship Council. So with that, we're going to go ahead and start off with our first presenter, which is Patrick Mathews, and he's going to talk about contingency planning and how what we'll do is we'll have about like 10 minutes of conversation from Patrick, and then we'll go ahead and open up to questions and answers. So Patrick, take it away. Actually, you have to unmute yourself first.
Welcome from Salinas in sunny Monterey County. Here we are in day 10 of our shelter-in-place order. My name is, again, Patrick Mathews, and I want to welcome all of you, and thank you, Tracie, for inviting us to sort of share what we're doing right now in terms of contingency planning. So I'll try to do this very quickly and do a quick overview. So our agency is a joint powers agency. We serve the eastern side of Monterey County, city of Salinas, and Gonzales, Soledad, Greenfield, and King City, as well as the eastern unincorporated Monterey County. We have 1 active landfill, 3 closed landfills, 1 large transfer station, 1 medium transfer station, 3 recycling centers, 1 household hazardous waste facility, 2 ABOP facilities, and the list goes on, but that's sort of the core of what our agency operates. So we started this process actually over 3 weeks ago, looking at, how are we going to address this if things like orders come down? So we were looking at this prior to the shelter-in-place orders. And so our process was fairly simple. We started with what is the absolute worst case scenario, and we worked backwards in terms of priority. So the worst case scenario is obviously the infection gets into the workforce in a large way. We have a large drop-off of employees. How do we define and what do we protect? What is our worst case? And the worst case is we need to keep the landfill open. That is the most essential service that we provide. Everything else is very important, but in a priority order, we still need the landfill if things were to get significantly worse, as we've seen in other countries. So with that, plan for the worst, hope for the best, we began looking at what are our scenarios, what are our triggers, and how do we react to this? And so really the first thing we started doing, and some of this actually began well before the shelter-in-place orders hit Monterey County on March 18th of last week. First thing is obviously the social protocols, washing. We began stocking up very early on all the essential sanitary supplies for staff, gels, wipes, sanitary sprays, gloves, just some of the basic PPE that we knew would be critical for us going forward in a more significant circumstance. We began installing some additional protective equipment. The one you're seeing now in grocery stores, we actually adopted and began installing early on for our cashiers, having basically plexiglass shields and instructions that the cashiers don't leave their gatehouses. All transactions are handled through a very small hand portal at the bottom. They're required now to mandatorily wear gloves. And so just some of the basic common sense PPE additions, as well as beginning to develop reserve force policies. So we've done two things. One, we've adopted an essential workforce policy where we've declared which employees are essential to our core operations, which ones are not essential. Included in that is also a telework policy update, which we already had in place from prior planning for other natural disasters, but that forced us to sort of reevaluate which employees are critical that can work from home and don't need to be either in the operations area or in our administrative area. One of the other things our board actually approved last night was an additional 80 hours of leave. Now, of course, under HR 6201, we're all required to do that anyway, but we saw that coming and got our board's authorization to expend operating reserve funds to fund an additional 80 hours for employees that will be asked to leave, not employees that become ill or something else happens to them necessarily, but really employees that are being impacted by policy decisions by the board or myself. So what we've done as of today, what we call our status quo scenario, which is trying to operate under the existing shelter in place, we've now removed approximately 1/3 of our workforce, put them on a 2-week leave. It's a mix of operating staff that with different skills, from line level folks up to heavy equipment operators and truck drivers. They're now on a mandatory 2-week shelter in place leave. They're supposed to follow all the requirements and basically stay healthy. That is our reserve force. And every 2 weeks, assuming this process extends itself, which we believe it will, every 2 weeks we'll roll that healthy workforce back in, assuming none of them have already been contaminated or become ill. We'll move them back into the workforce, move another 1/3 out. So we basically have right now a 6-week operating plan. Everything's fluid, of course. Our admin offices have been closed. There's only 2 full-time employees in the office, myself and the assistant general manager, and then several essential employees who are rotating into the office off and on an as-need basis to conduct other essential duties like IT work, AP, AR, clerk of the board, payroll. So keeping our essential operations. A lot of that's being done remotely as well because they're on our telework list and they've been all set up previously for that work, but they are coming into the office on an as-need basis. Unfortunately, we do have some non-essential staff that are basically out on leave until otherwise notified. The 80-hour leave will help them, but ultimately If this is extended significantly, we may be looking at either extending that support or requiring that people go on to look for other support services such as unemployment for temporary loss of pay. Managers, all our managers are essential employees. They all have and continue to telework as we've allowed in our policy in the past to begin with. And of course, we've done some of the basic things under status quo. We've ended all of our public cleanup programs. All of our community programs have all been canceled or postponed until further notice. So that's sort of status quo today. Now we're beginning to move on what we call sort of trigger one. And that's, we're starting to see some increase in community infection rates. Unfortunately, in Monterey County, we only have 27 reported cases as of last night, only 3 additional cases yesterday, no cases the day before. So right now, we're not seeing the huge acceleration in cases yet, but we are waiting to see if that does happen going forward. And so the trigger one, really, we start looking at things like reducing program, transfer station hours of operation, potentially restricting some public self-haul activities. We're working collaboratively with our sister agency, Monterey Regional Waste Management District, and our health agency to issue a joint statement that we can hand out to self-haul customers, because what we're finding is there's a lot of what we would call boredom cleaning. People are stuck at home. I personally have experienced that last weekend, running out of things to do that would have normally been filled with social time and outdoor time with friends, cleaning closets and cupboards, and realizing I'm throwing away some stuff that probably wouldn't have happened if I hadn't had this free time in my hands. We are still seeing that. And I think the concern we have as agencies and health department is, that's just increasing the number of exposures our employees may have. And so we'll be issuing a joint statement. We're not an enforcement agency, but trying to educate people on their personal responsibility to minimize contact out in the public. And so we already started to reduce a few of our hours of operation for our HHW facility and some other things, but nothing drastic. We're still basically hands-on normal operations today. Trigger 2 obviously is increasing noticing staff exposures, or the illness begins to get into the workforce. At that point, we'll start looking at the next priority closures or reductions, and that would be our recycling centers. Potentially reducing hours and days of operation of our HHW facility, and closing our smaller transfer station that could again free up some healthy employees to go into temporary shelter, and continuing to retain healthy employees in the background in the event we need them down the road. Then of course the third trigger, which is the worst case scenario, we begin to see significant infections moving through the workforce. Under those scenarios, we would look at potentially closing our large transfer station, all of our primary operations outside of the landfill, and consolidating everything we have left into keeping the landfill operating. Maybe not continuing to operate the compost and organics facility. We view that as actually a very beneficial piece of our response action. And so we want to look at that as sort of a last ditch thing that we would shut down temporarily and send that material to landfill. So just to quickly answer a few of the questions that were preemptively sent out to us. Precautions when staff is healthy. Well, I think we've discussed that. That really is, we're rotating staff in and out on 2-week blocks to make sure they're healthy and they're reserved for backfill as things happen. We also have some non-essential employees out from the office. Those too can also be rotated in to fill some of the lower line level jobs that we may need to have filled out in the operations. What if we have fewer staff available? Well, I think we've gone through the reductions or the actions and reductions that we're considering down the road. What if contractor staff or services become less available? Well, of course, we're already considering landfilling organics, which are mostly run by a private contractor. So there's the option of landfilling organics temporarily, or seeking an outside organics processor that still has the ability to process materials for short term for us. We also are looking and trying to establish some hauler contracts for private haulers. We do most of our own transfer work, but we have some on-call haulers that we're looking at establishing some more permanent contracts with those, either as backfill or for employees that are out on temporary leave, or down the road if we need them to fill in actually if we start seeing loss of employees due to illness. And then of course our large haulers, we're in constant communication with them. We all know that Waste Management has basically issued force majeure to most of our franchises. And of course the other haulers are probably in the process of doing that. Our biggest concern obviously is to make sure our smaller haulers that may not have those broad resources to fill in if the hauling force becomes ill. Those we're talking with now to find out what their contingency plans are. The other question is, what's your process for reducing facility hours and services? Again, very fluid situation. We're making those decisions on a case-by-case basis as we see the illness progress through the community and our workforce. And again, essential services in order of priority: landfill first, organic second, our large transfer station serving Salinas is third, household hazardous waste and ABOC facilities is next, our medium transfer station after that, our recycling centers and our administrative offices. So that's the order of priority that we're addressing reductions and closures with the intent that the landfill being the one thing most important to preserve. So my sort of closing comments are, one of the things we feel, and we've talked a little bit about, and we've heard this discussion going on, is the most important part is we're looking forward to the availability of full testing for all essential workforces, not just solid waste, but all the designated essential workforces. That's very critical, because we may all have what we're calling super workers, people that have already been infected, people that are already immune and recovered from it because they were asymptomatic or mildly symptomatic. Identifying those people, if they exist in our workforce, is very important, because now you have permanent people that can continue to work and not have to worry so much about the current social precautions. So we're looking forward to that day when we can see the government, federal, state, local governments begin to recognize the importance of testing essential workers to see if we have some of those folks in our system. And then finally, recovery planning. I know we'll be talking about that in the future, but we're beginning to have the discussions about what does the world look like when we come out of the shelter-in-place orders and we start to try to get back to normal operations. And so recovery planning is going to be just as important as what we're doing today. And that's all I have to say today. But if you have questions, please feel free.
Yeah, so we can take a couple. I know it looks like people have been sending them to the chat box, which is fantastic, and hopefully everybody's getting a chance to look at those comments regarding bulky item collection, increase in calls and things like that. Does anyone have a comment or a question? We'll take a couple. No? Everybody's going to be quiet? Well, we can, if you keep thinking about it, and then we'll move on to Ted.
I have a question, Patrick.
Sure.
So it sounds like sounds like from your operations, Patrick, it's more of a labor perspective. So if you, in worst case scenario, if you do ramp down services, that's as a result of labor, essentially, and the availability of labor. It sounds like for the most part, your operations, you've been able to incorporate basic PPE and social distancing requirements to maintain operations within today's environment.
That's correct. That's correct. Our highest priority is protecting our labor force first and foremost, because without them, we can't protect the essential services.
Great. Caitlin also asked, which staff are being rotated every 2 weeks, hauler staff or government staff?
Government staff. So that's we own and operate our own transfer station and landfill. So our priority right now is really focused around operations, physical operations. The admin staff, we've got a plan that's been used in the past for other natural disasters, and that's already been implemented, but the operations staff is where we're doing the rotations.
Okay, and forgive me, another question, are you still paying staff that is off rotation? I know you had mentioned getting funding to be able to help with that. You want to talk about that?
Yeah, just briefly. Last night, our board approved a resolution allocating about $250,000 of operating reserves, specifically to add an additional 80-hour or 2-work-week bank to available to all employees who are impacted by, these temporary orders or people that we're asking as an agency to go and shelter in place for future reserves. And so, yeah, the board has approved that. So we're thinking with the rotational plan that allocation from our board should be good for about 6 weeks.
Great. Thanks, Patrick. So if we have questions that come up, Patrick's obviously here for a while, so he can answer those questions. We're going to go ahead and move on to Ted, who is going to talk more about the day-to-day stuff that's going on and what his agency is doing. And so, Ted, go ahead and take it away.
Thanks, Tracie, and I sure appreciate CRRA putting together this whole webinar, because it's one of the great values of our organization is that we can help each other solve our common problems. So I'll just try to cover. First of all, I really want to underscore what Patrick just said, which is contingency planning. Look at what resources you have, what steps you're going to take as you need to ramp down if that comes up. So in general, some of the things that are most important, as thankfully we do not have community spread. We do not have a positive case yet in our county, but people are still moving around. So some of the most important things that I've found are having regular, reliable sources of information. I found that I'm glad CRRA is putting together a website. CSAC has a very good, essentially, link to other websites. The Johns Hopkins Hospital site has a great ongoing update about where the virus is, how it's spreaded, how are the active cases evolving. Other important pieces of information, such as how long the COVID-19 virus persists on surfaces. While the CDC guidance indicates that there's no special handling required unless it comes in as a medical waste, it still begs the question of how long are these viruses viable? And according to the New England Journal of Medicine, you've got aerosols that are active to up to 3 hours. The virus seems to be active for up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic or stainless steel. So thankfully, most of that is going to mean by the time the materials get to our transfer stations, they're probably not active, but it is important information to keep apprised of. Regarding the overview of changes, of course, we've got personal protective equipment. Sanitizing is probably the biggest thing we're doing. We're looking at all of the common touch surfaces, of course, 6 feet social distancing, shelter-in-place support, and of course, our public meeting changes regarding notices, using Zoom for meetings, and support from IT. Regarding our communications with staff, a lot of this, ironically, the illness, injury, and prevention plan has no provision for planning for pandemics, so we're adding a section on that. A lot of this comes down to supplies, recipes, and procedures. So we're using a diluted bleach solution for sanitizing our signature pad. And so that's 25 milliliters of bleach in 2 liters of water. We have 3 buckets. We do a wipe with the bleach solution, then a wipe with a water-soaked rag, and then a clean wipe afterwards. And that's after every single use of that signature pad, because we don't want to be a vector to the surrounding community. We also have over 70% alcohol wipes. Those are flammable, so you want to keep that in mind. The value of that is it dries out the virus, so you apply that, but it's got to dry off, and it is flammable, so you want to keep that in mind. Also, on the wipes, antibacterial wipes are not helpful in reducing this virus. While they may help in cleaning, they do not actually reduce the virus, so you want to look for the alcohol wipes. Communications to boost morale. This is a really important thing because, of course, people are looking to us as an essential community service. And the staff reactions have gone from, gee, I guess I'm glad I have a job, to, gosh, we're on the front lines and I may be exposing myself every time I come to work. So staff support's really important. People like to hear about what you're doing to keep everyone safe. So when people call and say, gosh, are you open? I've got all this stuff, I gotta come. It's it's really nice to say, yes, we are open our regular hours, and we ask that while you're here, you stay 6 feet away from everybody else. So that's encouraging to them. We're considering and probably will print vehicle placards for all of our employees, put in their vehicle to one more way to underscore that they are essential workers and that it's okay to have them on the roads. We're not yet at the point of having anybody being pulled over, but that's probably not far away. And I know in some communities that's currently happening. Of course, we have the working from home communications efforts. We found the application AnyDesk to be quite helpful, to be able to patch through from working at home onto your desktop computer and then into your server. That's very useful, and the regular texts and calls are really important in terms of communicating amongst the staff who are working at home to keep that esprit de corps and keep everybody satisfied and supported that they're all part of the same team working on an essential community service. We are altering schedules to reduce overlap, trying to preserve those core functions. We do not have the flexibility of having a third of our workforce in reserve. We're just too small. But we do try to keep as much of a core workforce available to deal with those contingencies as the disease progresses. So we're regularly disinfecting computers. We are emphasizing common touch surfaces. And we don't share pens anymore. We don't jump on each other's computers without sanitizing before and after. To the extent we use common keys for common vehicles, there's lots of sanitation going on there. Let's see. Regarding the contingency planning for employees, one of the things that we found out is that we really did need approval to have preventative administrative leave in consult with the chair, because people do have a right to their employment, and so if they don't have symptoms, you can't just send them home unless you have a process in place for that, because you're depriving them of their work. But that's an important thing to have in place, and have your board be okay with how you're dealing with that compensation and that time off. Regarding customer relations, I mentioned the regular disinfection of the signature pads and other items that are commonly touched by customers. We're using public service announcements and signage to communicate with everyone what we're doing. We're of course cleaning our public bathrooms, social distancing. Gloves and money are a big concern. So anyone who's handling money at all is required now to use gloves, and we have signage communicating that to our customers, also letting them know that employees have the option to wear bandanas to reduce hand-to-face contact, though none of our employees are symptomatic. We find both of those reassurances helpful, both to the employees to let them know that it's okay to wear a mask, we're totally fine with that, and to let our customers know that that doesn't mean that they have symptoms. We're probably going to implement vulnerable population hours starting next week, meaning we'll have a couple days a week where we put out public service announcements that those hours are really for vulnerable populations, and that for our seniors and for folks with health issues, that's the time that they can be self-haulered with minimal risk to our facilities. I noticed in some of the conversations about some of our promotions of reusable items, this will absolutely have an effect on all of those other programs. We're noticing in our local stores, for instance, while people are continue to bring in their own bags, they no longer want them on the conveyor, so you have to bag your own groceries at this point, but they are still allowing us to use those. We're of course minimizing our service desk contact with customers. And then, of course, board meetings are a separate issue. We're a rural enough area that it's rare for us to have more than 10 people in our board meeting room. So we're able to get away with continuing to have in-person meetings, but we are putting additional notices on the door of those meetings to let people know that if there are 10 people in the room, please watch it from home. We're all separating each other by greater distances. And of course, we're disinfecting between meetings. This will have further impacts on our reuse and recycling programs. I'm quite concerned about that. At this point in time, all our buyback services are on hold. I don't know when and how that will change. So that's our status report, and be happy to answer any questions.
So one of the questions that came in yesterday from Catherine with Culver City, she was interested to hear how others have been managing a home, homework scenario, the balance, not just computer issues, that's always just frustrating, but primarily like the learning curve to balance your home and your work life, since you're kind of doing both in the same place. You can't really escape it. So just curious if you have any feedback, and we can, of course, open that up to others unless you want to put in the chat box as well.
Just personally, I noticed that my productivity tends to go down quite a bit when I'm working at home, just because there's all those other home things that are distracting you. You can try to set up a separate room, but I'm open to other people's suggestions as well on that front.
Does anybody else have any best practices they've figured out over this last week? No? I don't have little ones, so I feel like my balance is, yeah, it's been tough, but I would love to hear from somebody who has small children trying to homeschool them and figure out how to get their work done at the same time.
Well, I know.
Right.
I concur with what Ted said. I've got a home office space, so and we do have a allowable telecommuting policy for many of our administrative officers and office workers. So most of us are used to working at home once in a while already, but it is tough for parents with young children. And our funding policy also included coverage for parents that have to stay home, because our schools now in Monterey County have been closed through May 4th. So a lot of daycares are shut down. And I know that's a challenge for people with little kids, being at home and having to try to balance those two things.
Great. So does anybody else have any other questions?
I've definitely resorted to the bad parenting television and Oreos this morning during one meeting.
That's awesome. And then there are comments in the chat box, so take a look at there as well. So let's go ahead and we'll move on to Colleen. Colleen's going to actually talk about the waste management side of things, which we all know is pretty intense right now. So Colleen, why don't you take it away?
Well, first of all, echoing everyone else, thank you to everyone for being on this webinar, and thank you, Tracie, for putting this together. I think I was having a meltdown last Saturday, and I'm like, we need to get our whole group of people together, and we need to talk to each other and help one another. So I think this is a great opportunity to do so. I also want to thank Kara for being on the call earlier and bringing some perspective from CalRecycle, because we definitely need support from the state at this point. So let's see, I'm going to give just a synopsis of the past 2 weeks for myself. I oversee the City of Oceanside Solid Waste and Recycling Program. We've got around 175,000 residents and 3,000 businesses. Day one of the COVID-19, when things really seemed to blow up last Monday, was the first day for our city's new food scraps rollout program. So the City of Oceanside had launched a mandatory commercial food scraps recycling program. We've spent, thanks to Tracie, a lot of her work, and with her team, and also Judy of Go20, we've spent the past 6 months getting ready to roll out food scraps recycling to every business. Tracie's team and Judy's team have been meeting with all of our businesses for the past 3 months to right-size their services, get them cited and trained to be able to have comprehensive food scraps recycling for every single business in the city. So of course, all the bins are ordered, everything's in place. Bills have already started to be adjusted for the first week of rollout, and day one of COVID was the delivery of all the bins to our businesses. So we had to put an immediate halt to that. That was a pretty tough decision, but obviously we didn't want to be trying to deliver food scrap recycling businesses to restaurants that are getting ordered shut down, or trying to even impose upon our businesses during this time. So that was day one, the decision between Waste Management and the city to delay the rollout. The question at that time was like, how long are we delaying this rollout? When do we want to bring it back? We had conversations of, okay, maybe April, but really we ended up within a day or two talking about May. And then even as I get through this event and work with our emergency operations center and our management, You know, we're really looking at trying to roll out a new program for our community. We want our community to be prepared for that and to be somewhat in recovery stages. So, you know, we may even be looking at this summer. So that was our first challenge. Day 2 of COVID was literally like, okay, Waste Management, who is our franchise hauler for the city of Oceanside, they provide solid waste and recycling collection services to our commercial customers and residents, was, okay, what happens in this environment? What if, you know, your labor force starts to get impacted? What if, you know, orders come down that impact your operations? And essentially there was no plan. There isn't a contingency plan within our agreement, or at least a contingency plan that really fits with this event. So it is a unique event. When, you know, you go into the language of our contract, which is a decade old, it focuses on, you know, tsunamis, earthquakes, you know, fires lightly, needs more language in there, but it doesn't really have strong language for a pandemic situation. So that was a challenge, and it has been a conundrum for both the city and Waste Management. So that's day 2. Day 3 in our experience of COVID was getting notified by Waste Management that they've closed down their Southern California call center office for all residents across Southern California if they happen to be a Waste Management customer. That notice came with no plan on how to support our customers. So if someone's trash was missed that day, if they would call the call center, they would just get an empty line. So we had to request that a voicemail be set up. There was no alternative phone number. They offered their digital chat system and their website as a resource, but their chat within 24 hours had become quickly overwhelmed. So the city had to set up an alternate phone number, and our poor Waste Management contract representative had to take all the customer calls. Trying to set a new number in the middle of services really just meant we got more and more calls to the city. When a customer got dropped into a closed call center, they obviously, what do they do next? They call the city or call the mayor. So that was day 3 for us, and has continued until finally the call center was just reopened last night. Day 4, our excitement of that day was recycling. Waste Management provided a notice to many of their cities, their contract cities across the state, that they were shutting down all of their recycling facilities and would be landfilling all of the recyclables. There was no plan or attempt to find alternative options for recycling. So basically, since for a week and a half, all of Oceanside's recyclables in any contract city with Waste Management here in California are going straight to the landfill. We have been in constant communication with Waste Management to request that, you know, they provide a good faith effort in finding alternative solutions. We've also been in contact with the state in regards to, you know, what is their compliance strategies? You know, when you even talk about the waiver perspective, the waiver, you know, references storage options, references utilizing other processors, and also references the need to show some good faith effort. So we've been pushing back on our hauler to look at alternative options. And the big question and conversation that's happened in that environment is Waste Management has taken the position that all the other processors still operating across the state are not operating within a safe realm for their employees. So Waste Management has made the decision that their safety standards are higher than anyone else's, and then if processors are open right now, they're not comfortable with them actually protecting their employees. So that's been a major crux of the conversation, which is why I've been reaching out to other haulers and other processors about how are you still in operation? And I've gotten a lot of great resources. OSHA has guidelines outlining how processors can still process recyclables and maintain PPE and social distancing guidelines. So really it's come down to a question on what is the basic level standard for safety of our employees, and what is something that is beyond that that's not really acceptable. So that's a major nexus of our conversation right now with our hauler. Why can't you go to a processor that's open to the city next door, that's in full operation by a reputable company and hauler, and really trying to understand the differences between facilities and between operators. So that was day 4. Day 5 was in discussion with the state and with our local county. There was a lot of I think at that time there was a lot of questions and misinformation on what is considered essential services. Luckily, the latest orders have identified solid waste collection as essential services, as well as recycling. I want to give thanks to the CalRecycle staff. They've provided a lot of help and information. But I think what continues to be a gray area in this conversation in light of COVID is the processing of organics or recyclables. So, you know, the order and the essential services identifies collection of these materials, but doesn't necessarily identify the processing as essential services. And when we talk about landfill capacity, when we talk about greenhouse gas emissions, the processing of these materials should definitely be considered essential services. So that's something that we as a city, we're trying to push for, and we're engaging with our local representatives to push for that, so that becomes clear and includes that aspect of it. Since that time, on day 6, which was last Saturday, which was why I asked Tracie to see if she could put this webinar together, was getting a notice, a general notice, not specifically to the city, but getting a general notice as a waste management contract city that of force majeure. So essentially, Waste Management notified the cities that they were imposing a state of force majeure and could not guarantee the services of their agreements. And so since then, we've been dealing with that, trying to manage that and push back, because we don't think at this point we're in that situation. Obviously, we need to plan for the worst, but we're hoping to see collaboration and work amongst our agencies as well as our various processors and haulers to avoid the reality of not having solid waste services at the end of the day, because this really is, our industry is a health and safety issue. From the City of Oceanside's perspective, I'm a EOC planning SITSTAT leader, and from that perspective right now, our most fragile utility, which we never would have expected, is solid waste. We're able to provide water services, we've still got energy, we're able to provide all our other basic essential services, but for the first time in an emergencies perspective, we're talking about the reality that the solid waste industry may not be prepared for. So that was day 6. Since that time, this past week, the focus has been obviously the pushback from our business community as they're getting shuttered down. They're having difficulty paying their own bills. Some of the first questions that we've been hearing is, I don't want to pay for trash. I don't want to pay for water services. Our trash and our water is connected. So we've been trying to develop utility relief programs and have been working with our water department as well as our waste hauler to provide relief and to eliminate any fees associated with starting or stopping services. We've also requested that we're keeping services on site as long as a public nuisance is not created. On a positive note, you know, the city's Green Oceanside Kitchen, which we developed for food recovery and sustainability and zero waste, has become a resource this week. Basically, that kitchen, the operator of the kitchen, the Oceanside Kitchen Collaborative, they are now contracted through emergency support funds to provide meals to our local community, our seniors, and our food insecure. And as part of that, they're actually taking leftover food from shuttered restaurants and turning that into meals. And so the goal is the Green Oceanside Kitchen will be producing around 3,500 meals a day to food insecurity. So we are seeing some positive light of food recovery and zero waste in action during this event. I kind of want to leave it as, you know, our big questions that I'm looking for engagement on is, I think, yes, first and foremost, the health and safety of our employees is extremely important. And at the same time, how as we as an industry can establish safe ways in order to move forward and to provide an essential service to our communities. At the end of the day, if we have trash, you know, filling up and carts filling up, we're going to be looking at other health and safety issues beyond COVID. So I'd really like to work with the industry to identify reasonable guidelines for health and employee safety, as well as share contingency planning. So we are ready for this, as this event could potentially get more severe in the next few weeks. That's all I've got for now.
Great, thank you. Crazy times for sure. One of the questions asked yesterday from Katie at San Diego County Regional Airport Authority, are people generally still participating in recycling and composting programs? Are you noticing that they're still participating? Or obviously there's a shift between commercial and residential because commercial businesses, if it's not essential, are closing down. Just curious your thoughts on that. Or anyone, Colleen, if you want to start.
So, I mean, yes, our residents and our businesses are still participating. Definitely more of a pushback. Especially, I'm concerned about rolling out our food scraps program after this because it's going to be even more hard to convince businesses that it's the right thing to do beyond just a mandate. So we are concerned about that, and I think we're going to have to change the dialogue. I see businesses and residents being less sensitive to it's a mandate. Well, they don't really care if it's a mandate. They care about feeding their children and being able to pay their bills. And I think that's a reality where we as an industry are going to see, especially as we try to implement these prescriptive laws in accordance with SB 1383. So we're very concerned about what that dialogue is going to look like.
The other question she has is, are there concerns regarding recycling and separation of materials that may be hindering the process? And I imagine with the recycling facility closing down, it's definitely an issue.
Well, I didn't bring that up, but that's been a big internal issue for us is other recycling facilities, other cities across my county and across the state are recycling the materials. It's just Waste Management has shut down their recycling facilities. So the city is asked, okay, are you going to put out a press release saying you're throwing everyone's recyclables away? And Waste Management has refused to do so because I don't think they want to be seen by the mass public as throwing recyclables away when other haulers are actually still doing the right thing. So that has been a challenge that I'm concerned about. And I'm not entirely sure how to engage with our public as that starts to come out, that their efforts are basically going down the trash.
So there's a question here, says where from CalRecycle, what document from CalRecycle outlined recycling collections as an essential service? Kara, I know we were talking about not having questions, but I believe that that's still in the works, correct?
That's correct. It will be forthcoming. I can't tell you exactly when, but it is coming.
Okay. And then as far as, this is another one for you, Kara, how does COVID-19 affect SB 1383 implementation? Same question. It's coming. It seems like the timeline's exactly
well, I mean, that's pretty broad. I don't know if they're asking about the implementation date of January 1, 2022, or if the upcoming comment period with the regs. So maybe the commenter could give me a little more specificity.
Okay. Another question here. Have there been additional requests for service changes in both residential and commercial, and how have you managed those? This is to Colleen. And I would say talking with, oh, go ahead.
No. There's the commercial requests in particular. We haven't had service request changes from residential as of yet because their bills are pretty standard. The commercial request, yes, they're trying to mitigate as far down as they can. Our city ordinance requires at minimum 2 times a week pickup to avoid public nuisance, but we have a contract administrator ability to change that. So we are allowing the dropping of services to 1 time a week in order to meet county health guidelines. So it's like, for example, if a restaurant is still open, their permit requires that they have minimum service levels per the county. So we've dropped it down to those minimum thresholds. And we're trying to just create some sort of documentation so we can easily reinstate services as they get into operation. But that's also a challenge as well.
Antonio from the city of Watsonville asked, the most common questions we get is, can I contact COVID-19 while in the process of collecting garbage and recycling? And they run fully automated. I think what we've been seeing as the answer is no, but I don't know if anybody has anything different to comment on that.
I do. What Recology has done here is they've tried to minimize their customer service desk to try to keep their drivers healthy, because it is a fully automated system. The thought is that that's our bottom level of services. We really want to keep collections in place and delivering to the transfer station, because if people can't self-haul, they can still sign up for service. So we're trying to keep those drivers healthy. Okay,
great. How are any of you handling business shutting down and wanting to eliminate service, yet the hauler wants to leave the container in place in order not to lose the business? Dumpsters attract unauthorized usage and uncollected waste.
So
Does anybody?
we are requiring that it has to be secured. So either it's a locked bin or it's in a secure location. If it doesn't meet those, then the hauler has to remove the bin, and it can be returned at reinstatement of services. And we're trying to waive any of those type of reinstatement, redelivery fees as well.
Looks like there's some good feedback on the chat box as well. Manuel with the City of Chula Vista was asking, regarding requests from our respective waste haulers to temporarily stop certain services, are you adjusting pricing or requesting for suspended services to be omitted from general service rates? I.e., if your hauler is not collecting yard waste, are you asking for the service to not be reflected on ratepayer invoices? Anybody?
No, Manuel has specific concerns about that because of the way their collection system is administered. Hasn't come up for us.
Okay. Is there a timeline for CalRecycle COVID guidance? I think that they are working on it, so I don't know that there's necessarily a timeline yet. We have a couple other questions. First of all, Marianne with Santa Cruz County. We are hearing supermarkets are starting to refuse the use of reusable bags from the customer, even if they bag their own goods. They want to use their own bags. Not sure if it will be the paper or plastic ones. I hear fabric is not considered a hard surface that could transport the virus. With COVID-19, which would be the best to use for all involved? Has anybody come across this? I hadn't. We know that Starbucks is not using reusable mugs right now. Well, they're not doing anything right now, but anybody have any comments on that? Through the chat box, or want to unmute yourself? No?
This is Katie. I do have a comment on that. There is a lot of research being done right now through a lot of different studies. I think one of the studies was actually mentioned earlier from the National Health Academy that says like how long the virus can stay on certain materials. Cloth materials can transmit the virus, but determining exactly how long the virus can maintain on a cloth material depends on the fabric and the environment that surrounds it. So they're thinking things like spandex can hold the virus longer than something that's more breathable like cotton. So the jury's still out on that. But yeah, we're dealing with that question here at the Airport Authority with lost and found items, which has been a challenge for us. So that's why I know about that.
Awesome, thank you. And Peter also said,
focus on the best management practice of washing your hands, hand sanitizer, even in the I call it the re-advent of disposables, because now all the to-go-ware, all the disposable to-go-ware is coming back. You see, coffee houses doing that, etc. There's still someone at the end of the day touching that disposable to-go-ware when they hand that cup over to you or that product over to you. I go grocery shopping, I look at, I pick up a box of cookies and then I put it down and someone else picks up that box of cookies. So we're trying to focus and educate our customers instead of being fearful of everything they touch, to focus on not touching their face, washing their hands, social distancing, hand sanitizer, etc.
So before we wrap up, I have one other thing. Judy Gregory, did you want to go ahead and talk briefly about what you are trying to do for planning? Just maybe a quick minute to talk about that.
Sure. Okay, cool. Thanks. Can you guys hear me?
Yep.
Yeah? Okay. So, well, first of all, thanks. This webinar has been absolutely amazing. So all of the panelists, I appreciate the information because it's very eye-opening. And I think it just kind of emphasizes the fact that, we're all making efforts to work through this, but we weren't as prepared as we probably thought we would be, right? Like all of our contracts have clauses for emergency situations or what to do, but we're all finding that, we're grasping at information and trying to work within our networks. And so it kind of brought up this idea that, do we need a more permanent outlet, whether it be an organization or a technical council or some sort of resource for working together, even when we're not in an emergency situation, to be gathering information, sharing resources, and keeping this conversation going, even when we're not in the emergency, so that when the emergency happens, we know right where to go, where we can work together and start immediately sharing information, because like Colleen said, you know, we were talking this weekend and we started immediately in our group talking about, hey, what's going on and how can we respond? But I think that we need that on a bigger scale. And, you know, California, but even across the nation, you know, we're in our industry, we're finding that as we have fires or as we have other emergency situations, we're still sort of chasing our tail to come up with solutions as they happen. So that's sort of my idea, is that I'm thinking that we need to start developing and working towards something that will be more permanent in place, to where things like this happen, we already know how to connect and start working together.
Awesome, thank you. And I think that conversation over the forum, which we'll talk about in just one second, would be really helpful. So one thing I forgot to mention earlier on, and David, thank you, David Biederman, for being on the call and being a SWANA member and president of the current local chapter. I neglected in mentioning that SWANA has a lot of resources on their website, but also look at the letter that they have on their website. It's for essential services. So I don't know if this has been happening in your neighborhood, but up here in San Jose, police officers are fining $450 if you're out and about and you're not performing an essential service. So the idea would be to take a look at that letter and carry it around with you, because the industry that we're in, we are considered an essential service. So take some time to protect yourself as you're out there, especially if you're just going to get groceries in the morning. And then I also want to talk about the forum. So Despina was going to take a second to talk to you about how to sign up for the forum, because this is the next step. We're having this conversation as the beginning conversation. Our next webinar will be on Thursday, April 9th, because Friday is Good Friday. So it'll be at 10 a.m. because from the surveys that we got yesterday, 10 a.m. seemed to work with everybody. So it'll be Thursday, April 9th at 10 a.m. If you've got some ideas on content and what you want to dive in more, let's talk about that. But Despina, you want to show everybody how to get into the forum real quick?
Sure, absolutely. So all of you have a profile on the CRRA portal, which is how you were able to register for the call today. You'll be able to access by visiting crra.wildapricot.org, and we'll send that link out afterwards. You'll notice on the menu here we have forums, and you'll see the COVID-19 forum. The forum allows you to post questions. If you're not a member of CRRA, you cannot post a question, but you can email it to me and I will post it for you. Everyone is able to, and I apologize, the website's a little slow because it's being accessed quite a bit today. But once we get into the forum, you'll be able to see here questions. You'll be able to post questions, conversations. You can subscribe either to the entire forum and get updates as you choose, daily, weekly, or immediately on any of the questions, conversations, or documents that are posted, or you can click into a topic, and of course you can have more topics here, and just subscribe to a specific topic. So we urge you to use this. All of the content will be here. You don't necessarily have to register for this at all, but it's a resource that you can come to and just look and see what other people are curious about, resources that are being posted, information. So, and if you have any questions on it or run into any issues, both Lauren and I are available to answer any questions you may have. And we're hoping that this forum will help facilitate further conversation, sharing ideas, best practices, reaching out with one another, because right now we've got each other and we're going through a lot. And so we can help each other at the same time. Reminder, if you want a CEU through SWANA, let us know, send us an email. And lastly, thank you for attending. CRRA is really happy that everybody took the time today to be here. I think the topic is obviously incredibly challenging, and thank you to the presenters for being here, Colleen, Ted, and Patrick, and thanks to Tara for attending as well. And everybody stay safe, have a great weekend, and we'll be in touch over email. So thanks so much.
Be safe, everybody. Bye-bye.
Thank you.